Well, good morning, everyone. And once again, welcome to another live this morning. Nice to have you on with us. Question and answer Monday. And as always, let's say hello as you get your notifications here. Thanks for coming on. Michael, Norland, Wendy from Wasaga. And okay, here we go. People are getting their notifications. I can tell. Say hello there. We'll do a little bit of a roll call. Marlene, how are you? Janice, Brampton. And Nick from our staff. And Joni, Alliston. Norma, Texas. Madeleine, Kippawa, Quebec. Fran from Orangeville, good morning to you. Wendy from Markham. And Jeanette from our staff. Donna, Park Hill. Vince, how are you from Tirana? Nellie, good morning. Frida, nice to have you on with us. Georgie, Halifax, Nova Scotia. There's Brahim. Brahim, what happened to you? Suzanne, Edmonton. Kevin, Oshawa, good morning. Yaloun. And Yaloun said she missed me on Friday. Mary, Sue, Bolton. Yvonne, Petawawa. Jeanette, how are you? And Janine, West Kelowna. Maria, Ottawa. Mara, good morning. Kathy, go Oilers, go. Rosalinda. And Francis from Vaughan. Wanda, Ridgeway. And Elaine, St. John's, Newfoundland. Wanda, Virginia. John, there he is, our friend from Elgin, Illinois. Hi, Luella from West Tennessee. Rita from Wasaga. And is that Melika? And Jeanette. And Donna. And Sue. And another Donna from Diane, Thunder Bay. And Linda. Oh, those Lindas. Monica, Selkirk. And who is that? I can't see the name. Kim, how are you? Catherine, Ruth, how are you? And I think that was Fran up there, but I can't tell. Cheryl, good morning. It gets into the clouds up there, guys. And Dave, how are you? Sharon from Kansas. Donna, good morning to you. Star, Richmond Hill. Two more. Cecilia, good morning. And Dale, hi. And Elaine, good morning. Okay, let's get to the questions. I know I missed some of you, and I don't mean to miss you. Evangeline, good morning to you. When I see your name, but sometimes, guys, you know me, I'm a senior. Okay, Debbie, Sturgeon Falls. Guys, coast to coast, Canada and the United States, we appreciate you. And we get them from all around the world, too, but we want to say hello to all of you. Dorothy's asking, what are my thoughts on ischemic stroke in the eye? Well, no fun under the sun. And ischemic stroke, look, have I seen it rehabbed? Yep, I have. Here's what I recommend, okay? And what it is, okay? Ischemic means a blood supply, okay? And it's been cut off due to a stroke. That's what it means. And at the end of the day, you're fearfully and wonderfully made. Your body can come back, okay? Your body can come back. Give it the tools, okay? Nothing better. I think somebody else is asking a question about the eyes, and I'll repeat it when we get to it. Nothing better for your circulation behind your eye. Because when you look into an eye, when an ophthalmologist, when an optometrist, when a family doctor looks into an eye, at the end of the day, it's nothing but blood. Okay? Really. That's really what they're looking at. They're looking at highway, there's all these blood vessels. I think of Toronto. You drive through, I was in Toronto on Friday. I hate the traffic. But you can take the 401, you can take the 407, you can take the 403, the Don Valley parking lot, you can take that one too. That's what we used to call it even when I was going to school in Toronto. The Don Valley parking lot, because nothing moved on it. Okay? And that was in the 70s. Can you imagine what it is today? Anyway. So, at the end of the day, when you look into an eye, the biggest thing happening in the eye is that blood supply. If it gets cut off, if blood supply gets diminished, if it's weakened, and one thing, remember this, okay? Just about eyes, remember this. Nothing will destroy your eyes more than sugar. It will destroy your eyes because sugar is so toxic to blood vessels. Okay, I've taught you that over the years. And that's why diabetics, they have trouble with their eyes. They often get diabetic retinopathy. They are much more susceptible to glaucoma. They're much more susceptible to macular degeneration. They're much more susceptible to kidney malfunction, blood supply, and heart, blood supply. Alzheimer's, blood supply. Sugar is toxic to your blood vessels. Got the memo? Yeah. Okay. Eyes, ischemic stroke. Okay. You already had a stroke. Okay. Can the eye regenerate? Regenerate the blood supply to it. High DHA and Navitol. I put those two together. There's nothing better on the planet than putting those two together for eyes. Dry eyes, whatever, the best. I've shown this to optometrists over the years and a few ophthalmologists. Please tell your patients to take high DHA oil, proven, and lubricate the eye, high DHA oil. Fatten up your eyeballs. Your eyeballs need fat. High DHA. Okay? Thank you for the question. And that was Dorothy Carolyn. When we are under stress, the nutrients we take in are compromised. True. And can be depleted. True. So do we need more than our daily suggested amount? Well, Carolyn, that's a good question. If you are under stress, yes. Because remember what stress is, okay? Let me just give you a little teaching again. Stress is cortisol. Cortisol is the fight or flight. Right? So your body's not thinking of digestion. Your body's thinking of fighting or running. Running away. Okay? That's what cortisol is. And that's all right. It's on your side. Okay? Everybody's got cortisol. And everybody secretes it. Cortisol is on your side. It helps you to get up in the morning. It's part of your circadian rhythm. It elevates your blood sugar. It elevates your blood pressure temporarily, just to wake up, just to get going. But what if it's on all day? A lot of people, they go through anxiety. They got stress in their life. And yeah, that takes away I used to call cortisol in my office a diversion. It gets your body away from doing what it needs to do because it's in the fight or flight. And yep, you might need more nutrients, okay? That's why, one of the reasons I created, at the Martin Clinic, we created the multi-nutrient, okay? Formerly Blood Boost. For people like that just needed extra nutrition. Now, let me give you a little tidbit too. When it comes to stress, think of what cortisol does. It elevates the blood sugar. Okay? That's its job. Okay? And what goes up must come down. So the body fights to bring it down afterwards, that blood sugar. And a lot of people suffer what we call hypoglycemia. They get low blood sugar because their thing goes up and then it comes back down. I did a whole, man, I don't know how many programs on my radio show years ago about hypoglycemia, and very much related to the cortisol. And when I used to see patients with chronic fatigue syndrome, they had big time trouble with their blood sugar fluctuations because their cortisol was up. Cortisol goes up, it takes your blood sugar up. What goes up must come down. So I was big on eating protein, especially eggs, meat, and cheese, because there's nothing that will control your blood sugar in terms of food than those foods. Protein and fat, not fat and carbs, protein and fat. In nature, the way God intended us to eat. Eggs, meat, and cheese. Eggs, meat, and cheese. Okay? That will help with your cortisol. Okay? It really does because of the blood sugar control. Okay, Carolyn, thank you for the question. Nikki, what is your opinion on beta blockers for non-sustained VT? Okay. Ventricular tachycardia. Okay. Look, I'm not going to talk about beta blockers so much. I mean, there's a lot of side effects, but if you got to take them, you got to take them. I'm never telling people not to take their meds, but are there natural supplements to help electrical impulses in the heart? Yeah. You know where the most magnesium is made? In your body. Your body makes magnesium. And body takes magnesium. So you got to eat it. The problem with magnesium is we don't have the supply of magnesium in our food that we used to. It's not in the soil anymore. Magnesium has been really stripped away out of the soil, and a lot of people are deficient in magnesium. So magnesium and the heart go together. So when you're talking about electrolytes, when you're talking about minerals, magnesium is very important. Magnesium is like a channel blocker. Okay, you'll hear drugs that are channel blockers for calcium. Calcium channel blockers. What is that? Magnesium. It doesn't allow too much calcium into the cell. You need some, but you don't want lots. So magnesium is a calcium blocker. So that's the mineral I think of the most. Look, your heart needs potassium too. Okay? And so you might look at, I'd certainly have a patient on magnesium, either the citrate or the biglycinate. Okay, and probably around 500 milligrams a day. Magnesium, very, very good for the heart. A lot of people that have AFib are missing magnesium. Over the years, I saw that. A lot of people were very low in CoQ10, ubiquinol. They weren't eating enough steak. You want ubiquinol? You need steak. Or you need to take it as a supplement if you got, because of the amount of mitochondria in the battery packs in that heart muscle. Anyway, thanks for the question, Nikki Maureen. What do you do what do you recommend to dissolve gallbladder stones? Well, look, I mean, there's some tricks of the trade. You know, drinking some, I used to have a little potion I'd put together with lemon juice, olive oil, and it was more to lubricate the stones. But let me back up for a minute, okay? Just so, Maureen, that people know where I'm coming from. The reason you get stones in the first place, how do people get gallstones? Use it or lose it. Because what happens in our day and age, people are told fat makes you fat, and fat gives you cholesterol. And so they avoid it. They eat yogurt, fat-free, Dr. Martin. I said, well, that's stupid. Why do you want to have fat-free yogurt? You need the fat. God put protein and fat together. And if you don't use your gallbladder, you'll lose it. Plus, women are more susceptible to gallstones. Why is that? The smooth muscle of the gallbladder, the little sac, is a smooth muscle, like their bladder. Why do women get bladder infections more than men? Smooth muscle. And that smooth muscle is affected by estrogen dominance. When you have too much estrogen, ladies, you're too much of a woman, ladies. You don't have enough progesterone. Progesterone is pro-babies. Absolutely essential for women because it balances out their estrogen. You know how many thousands of times Dr. Martin heard this? My doctor said I got too much estrogen. I said, nah, you really don't. Okay? Or excuse me. Too much, not enough estrogen. I just had a senior moment. Not enough estrogen. I said, nah, you got enough estrogen. What you don't have is enough progesterone. And so ladies, you can get a double whammo on your gallbladder. Why do you think so many women have trouble with gallbladder? One, they don't use it. If you let that bile, remember, bile isn't made in your gallbladder, bile is made in your liver. What does bile do? Think of dish soap. Okay? Bile is alkaline. Okay? So one that food comes out of that very, very, very acidic stomach, bile neutralizes it. Okay? 1. 2, bile emulsifies fat. Dish soap. Greasy dishes. You use dish soap. Right? What does it do? It takes the grease off your pans. That's what your gallbladder's bile is for. To emulsify the fat. So it's part of your absorption especially of fat, but also your fat-soluble vitamins, like vitamin A and vitamin K2, vitamin D. You need bile, okay? So, I had my little potion, but here was more effective than that. You know what I used to tell my patients? That had gallstones, don't eat at night. Don't. You're going to have to temporarily cut back on your fat. Temporarily. But the biggest thing is using that intermittent fasting. Give yourself lots of time before you go to bed. Stop eating, and and your body will break those stones down. Okay? Now, if it ever gets caught in a duct or whatever, you might need surgery. Okay? I'm not against that. And you can live without your gallbladder. How many millions of people don't have a gallbladder? And they can live without it. Because bile doesn't come from your gallbladder, it comes from your liver. Now, your gallbladder is important. I want you to keep it if you can. Okay. Thanks for the question. We appreciate it. Boy, I get into these diatribes. Donna asking about complex regional pain syndrome. That's when you get a real pain in either an arm or a leg, and it's really bad, and it's no fun under the sun. Is it reversible? Well, I'm trying to think if I've seen it reversible. Look, possibly. Okay? Possibly. When I used to see any kind of chronic pain, okay? Chronic pain, severe osteoarthritis or after an injury, trauma, after a stroke, I was big on doing the reset because that will cut your inflammation markers down, proven. CRP, C-reactive protein goes down. Inflammation markers go down. It's so good for you, okay? And I was really big on, that's why we created our inflammation formula, okay? And curcumin. Vitamin D is very anti-inflammatory. Did you know that? So, and don't eat sugar. Because sugar will aggravate your pain big time. It is very inflammatory. Lay off the sugar and try and lay off those fast foods that are made with vegetable oils. They're very inflammatory because they're high in omega-6. So stay away from the hateful 8. From canola to safflower to soy, all those bad oils that are made by man and not made by God. Okay? Okay. Let me see here. And Deborah's asking, for kidneys, I do take probiotics. Always a good idea to take probiotics, no matter what. I know about the reset. And I know about water. Well, good for you, Deborah. Water, vitamin W for kidneys. Why? Because your kidneys are Niagara Falls. Go to Niagara Falls at any time of the day, and the water is flowing. And you need water, and only water is water. Okay? Nothing else is water for your kidneys. Dr. Martin, I don't like water. Well, suck it up, Buttercup. You need water. Drink it. It will flush your kidneys. There's not a better kidney cleanse in the world than water. Okay. Now, would Navitol be helpful for elevated EGFR? Yes, yes, and yes. Why is that? Why is Navitol so good for the kidneys? Why is Navitol so good for blood pressure? Why? Always ask the question, why? Okay? Why, Dr. Martin? Here's why. Because Navitol, not only is it a powerful antioxidant that will protect the blood supply and the tissue of your kidneys, but it also elevates your nitric oxide, which is your blood vessels. It opens up your blood supply. It opens up the blood vessels. So it protects the lining of your blood vessels and then plus opens up those blood vessels. Navitol, I'm big on it. It's really, really good for your kidney. And I think somebody asked the question. Let me just see. I might be able to answer another one here. I'm just seeing. I thought somebody asked me about. Anyway. Maybe yeah, here it is. Do you know, Deanna is asking, do you know if high creatine kinase is because of a high protein diet? Nope. It's the opposite. Whenever you get negative kidney blood tests and you got flagged, kidney function's not quite as high, your creatinine levels are high, you got kidney stress. It's sugar. It's crappy carbohydrates. And it's the opposite. Steak helps your kidneys. Okay? Eggs, meat, and cheese helps your kidneys. Protein is good for your kidneys. I posted this on our private Facebook group the other day. Maybe I'll post it again. They got it wrong. Your kidneys are destroyed by sugar, not by protein. Eggs, meat, and cheese. Okay, Deanna, I knew there was another question there. Bonnie, I've had a cough for a month. You know what? A lot of people are getting, look, you could get a cough for a lot of reasons, but a lot of people have sort of contacted me, or I've seen it, where they got this bug and they had a cough for a month. Okay? And it's like a post-viral. That's what I've seen mostly. Okay? Post-viral syndrome type of thing. And their lungs I talked to a lady yesterday. Post-viral. I said, do the vitamin D hammer. Hammer with vitamin D. Okay? For a couple of days, 2 or 3 days. Nothing will respond better than to that virus, post-virus, to vitamin D. I really like it. Go sit in the sun. And don't burn, but get in the sun. And if you can do the hammer, get about 50,000 IUs for 3 days, a day. Okay? Now, don't try and get me in trouble, because I'll deny I ever knew you. I'm not supposed to be giving out dosages, but generally this is what I found to be effective for me. There we go. Sherry, I think I answered this the other day, Sherry, but I'll answer it again. What do I think of colon hydrotherapy? Not much. I don't like washing out your colon. Okay? Look, people have this idea. Okay? They see a tube. And they see crud in there, okay? A tube. That's your colon. It's a tube. and it's gummed up, they say, right? And, feces has got caked on and whatever. Let's do a washing. So let's put a hose up there and wash out your colon. And I don't like that. I don't recommend that. Okay? And I know it's gentle and this and that, and you know what? And look, you should see the stuff that came out. Well, what did you expect? What did you think it'd come out? Little pink packages? You're much better, in my opinion. You want to do a cleanse of your colon. Drink water. Drink coffee. That's better. I don't like the washing out. When people get a colonoscopy, they're wiping out all their bacteria there. They're good. You see, the problem is in the gut, you got good and bad. And when you do a washing, you're taking all the good guys out too. I don't particularly like it. I don't think it's needed. I'm much bigger on replacing, renewing, regenerating your probiotics, your friendly bacteria. Drink water. There's nothing better for your colon than water and coffee. Why do you think, guys, God's given you a gift, a cleanse. God's given you a gift. Would you accept it and enjoy it and be happy? You get to drink water and coffee. Nothing better for your bowel. Nothing. And probiotics. Replace, renew, regenerate. My 3 R's for the gut. Okay? Replace, renew, and regenerate that bacteria. Colon therapy, hydrotherapy. Listen, I'm not big on that. Okay? That's me. Okay? And I think I'm right. Okay. Okay, let's do a few more here. Sandy, why is my saliva pH so different than my urine pH? Well, they should be. Saliva inside the body, urine outside the body. Okay? Your urine is, think of it, you're detoxing. You're getting rid of. Your urine is going to be more acidic than your saliva. Or at least it should be. Guys, I did a whole teaching on this. And maybe I should review it and review it with you guys. I talked about how your body tightly regulates your pH. Okay? It tightly regulates it. Your body is dedicated to keeping your pH of your blood slightly alkaline. Okay? Slightly alkaline. Very important for you. And your saliva, it's not a good indicator, guys. Like, people live and die on a pH strip. Don't do that. Don't do that. I was big on urine pH first thing in the morning, even before drinking water. I wanted to look at your pH to see if you were detoxing at night. Out of the body, urine. I like to look at that pH. Saliva, I did it. I didn't mean nothing to me. Saliva, I used to like more hormones there. I could tell you what your pH, but I never, I didn't, who cares so much? Because pH is good, it's important to look at it, but your blood pH isn't going to move very much. It's not supposed to. And only when you're dying does your pH become acidic. You get ketoacidosis. This is why doctors, because they don't understand nutrition, they haven't taken more than an hour in medical school, they don't even understand what ketosis is versus ketoacidosis. They're two different things altogether. And they confuse them. That's why they don't like keto. And by the way, I'm not big on keto. I don't like all the keto foods. I'm a big guy on natural keto. What do I mean by that? Eggs, meat, and cheese. That's natural keto. Eat foods that are good for you. Okay? And it's the way your body was designed. You don't want to live on carbohydrates. You're not meant to live on bread alone. That's what the Bible says. Okay? Man shall not live by bread alone. So it's really important to understand that with pH. Okay? Your body tightly regulates it. Your saliva is going to be different than your urine. You don't try and get them together. And in my opinion, don't take a urine pH anytime other than first thing in the morning before you even had water. That will give you an indication. If your pH is around 5, I like that in the morning. Very, very, very acidic. Should be. You got rid of your body's self-cleaning oven, worked overnight. You went into autophagy and you detoxed, and your urine will reflect that on its pH. Okay? Got the memo? Okay. Okay, let me see. Let's do one more, and we got some questions for tomorrow. We'll continue this. Okay, Lise, let's make this one the last one for today. Lise, I have a huge Baker cyst behind my knee. No fun. Under the sun. It happened from a fall I had last September. Anything can help this. Well, again, I used to do a hammer of inflammation formula. You can do it with turmeric and Navitol, even high DHA, very good, all anti-inflammatory. Do the hammer. Do it for about 3 or 4 days. Get in a good dosage of that, Lise. And some people have really gotten tremendous benefits from that. The inflammation come right out. Okay? The inflammation come right out. Now, I know doctors a lot of times into a Baker cyst, they'll put a cortisone shot in there. And, sometimes that can be dramatically effective. But you don't want to take too much cortisone. Okay? Not cortisol. Remember, it's cortisone. And like prednisone and all that. There's a lot of side effects to that. But, okay. Anyway, give you an idea. Okay, guys. Thank you for coming on this morning. We appreciate it. Thank you for all the support. Thank you for all those folks on our private Facebook group. You guys are wonderful. We mean it. Top of the line, the best of the best is you guys. Okay? We love you dearly. We'll talk to you soon.